Okay, well, without further ado, I'll get started. Welcome everyone to the National Learning Event for Core20PLUS Connector Sites. My name is Sarah Sweeney and I'm Director of Membership and Development at National Voices, which is a coalition of over 200 health and care charities. And today I'll be chairing the event. Now there's just a few bits of housekeeping for today's session. And really, the first one is, and it feels a bit silly saying this because I know that most people are in their own homes, but please just make yourself at home. If you want to get up and have a cup of coffee or a glass of water or walk around your home, please feel free to do that. Feel free to take this as informally as you'd like. On a really practical note, there will be up to 200 people at key moments in this call. So we really ask everyone to keep themselves on mute, otherwise we'll get a really terrible echo and it'll be very hard to hear one another. So please do pop yourself on mute if you're not chatting. And then in terms of videos, as speakers, it's always really lovely to see as many faces as possible, just so you can see that people are there and listening and how people might be responding to what you're saying. So if you feel comfortable with putting on a video, we ask you to do that too. We are recording today's meeting and the plan will be to upload that recording on YouTube. The main people who kind of featured are those who are spotlighted, so like myself and Maren and Andrew right now would appear in the actual video that comes up on YouTube. But if anyone doesn't feel comfortable with the recording of themselves going on YouTube, then just pop us a little message, like an email or something, and we can have a little chat about how we can protect your privacy and things if there's any concerns there. I know that there will be people joining us today who will be reliant on closed captions to really make the best use of this event. If this is you, there'll be some information in the chat about how to turn on closed captions. Is something you have to do yourself. Pavi, do you mind just going to the next slide? Yeah, so you would click on the 3 dots down the bottom of your screen, whether that's on a phone or on your laptop, and that'll generate some closed captions for you. We can press closed captions on the menu. I'm joined today by my colleague Pavi, who's supporting with tech on this. So if you've got a tech issue, Pavi will do her best to help support you with that. Now to the practical bits. So today's event is organised by National Voices and supported by the NHS England Health Inequalities Improvement Team, SCW, and the Health Creation Alliance as part of the Core20PLUS Connectors Programme. Now you'll hear from representatives from each of these organisations throughout today's event. But also you'll see spotlighted on the screen Maren from the Health Creation Alliance, Andrew from SCW, and Bola from NHS England, just so you can put some faces to names of who comes from those organisations. As many of you will know, the Core20PLUS Connectors Programme is part of the support framework for progressing the goals of Core20+5, which is the NHS approach to support the reduction of health inequalities at a national and system level. Through the programme, NHS England funds integrated care systems, which are called ICSs for short, to recruit, mobilise and support influential community connectors to take practical action to reduce health inequalities in their local communities. This event has been created for everyone who's been part of the Connectors Programme to date. So I want to say a special thank you and welcome to delivery partners from the NHS who are in the room, to all the representatives from voluntary sector organisations and from Healthwatch who are in the room, but a particular and warm thank you and welcome to connectors who are here with us today. We know what an important role that you play in reducing health inequalities in the communities that you're from and that you're working with. And I know that we're going to hear lots of stories today about the very tangible changes you're making in people's lives, making sure people are diagnosed with cancer earlier, making sure young people have access to oral health at the right time, supporting the uptake of vaccines and much more. And I also know that too often the NHS can in places fall short in delivering services to some communities, and the important work that connectors are doing up and down the country to make the NHS more inclusive and more accessible. So thank you for that. Pavi, can you go to the next slide, please? So up on the screen, you'll see the agenda for today's event. You're in session 1 right now. So there'll be a welcome message from Bola Olabi, and then a panel discussion on using community insights to address systemic inequalities in the NHS and healthcare. The second session of the day begins at 3, and it's looking at developing strong, equal and trusting partnerships between the NHS with people and communities. And the third and final session of the day is at 4 p.m. and it's looking at how can we make the work of the programme sustainable. But really, first of all, I wanted to get a sense of who's in the room. So thanks to everyone who's introduced themselves in the chat. Patty, could you just pop to the next slide, please? The next thing I'm going to ask everyone to do is to just click on a little link in the chat, which is to a tool called Mentimeter, or you can go to the website menti.com and enter the code that's up on the screen, or you can use your phone for the QR code, and that'll bring you to like a little map of England where you can kind of plot where you are on a map, and then we can get a bit of a sense about where everyone is in the room. So there's menti.com, and then you'd enter in 33330450. And I can see that there's been a bit of a capacity issue for some reason. We'll try to get that resolved as quickly as possible. So 33330450. Sorry, bear with me a wee second. Anne has said that the code isn't recognised. I'm not sure if other people are having the same issue. Pavi, do you mind just going to the next slide so we can see if any responses have come through yet, please? And someone said if you use the link in the chat, you won't need the code. Okay, fabulous. So I can see that some people are responding to it. So we've got a really good spread of people across the country. Got one slightly lonely person in the southwest, so hopefully more people will join from the southwest. But yeah, lots of people up near Yorkshire and Humber. Lots of people are in London. You can see where the London demographic sits. Fabulous. Thank you so much for that, everyone. That's really interesting to see. And before we move to our first talk of the day, I just also want to ask you to go to the next Mentimeter slide. So Pavi, can you move people along to the next Mentimeter slide there, please? And for this, we've got a question that we'd like you to type out a response to. And that question is, if you had a magic wand and could make one change to reduce healthcare inequalities, what would it be? Really keen to hear about what you think are the kind of key priority things that need to happen. If you are having any issues with using Mentimeter, then please just pop that right into the chat function in Zoom. Just type it on in there. If you had a magic wand and could make one change to reduce healthcare inequalities, what would it be? Fabulous. And I think as people start to fill this in, that'll start to pop up on the screen. Take me a moment. Okay, I can see that a couple of people are having a little challenge with mentimeter.com. So it's minti.com. And then you use the code at the top of the screen now, which is 26189621. Or you should just be able to click the little link that Grace has just put in the chat, and that should work too. And it looks like you can draw out some responses there. I think that there might be a slight issue there. Sorry. If people could just pop their responses into the chat, probably the best thing, because it looks like it's letting people draw things, but that might be a very hard way to describe that. So if you want to pop into the chat, if you had a magic wand and could make one change to reduce healthcare inequalities, what would it be? Ah, some people have got it in. I'm not sure why that was appearing that way. So we've got 46 responses. So secure housing, giving power to communities, eliminating poverty, a fully resourced NHS would make a really big difference, accurate joined up data, more funding to make the changes happen, improving access. And can you just scroll down there a bit for me, Pavi, please? I think if you keep the mentimeter.com open there, Pavi, and just scroll down so we can see some more of the responses, that would be great. Yes. Does it let you scroll down? I'm thinking that's not the case, but we will bring that all together into one place. So thanks to everyone for sharing that. We'll make a little resource for that after the event. Okay, fabulous. So without further ado, I want to hand over to our first speaker of the day to share some opening words, and then we'll have a small panel discussion. I'd like to introduce Professor Bola Owolabi, who's Director of the Health Inequalities Improvement Programme at NHS England. Bola, over to you.
Thank you so much, Sarah. Good afternoon, colleagues. I hope you can all hear me okay. It's always exciting to be with you, and I especially love being with our Core 20 Plus connectors because you're the ones helping us to translate our policy into something meaningful, out in the community. And as a GP myself, policy is fine, strategy is fine, but where I'm at my best is out in the community where stuff is going on. And that is why I'm always looking forward to the opportunity to be with our Core 20 Plus connectors. So I was in Hull last Thursday, Hull Royal Infirmary. And for me, going back after decades following being a junior house officer, very young, bright-eyed, bushy-tailed, and going back last week to be with the homelessness service, the joint effort between the acute trust, a GP provider, and a voluntary sector organization. And something one of the patients said to me, they saved my life. And he was referring to the homelessness worker, Anna, and how over all these years, she believed him. She believed when he said he was in pain. She got the doctors to believe him. And because they believed him, I had the fortune of meeting this patient after months of being drug free, being discharged from hospital into supported accommodation, and looking forward to a hopeful future. That's what happens in real life when people like yourselves, the Core 20 Plus connectors, when you connect with people in a way that is meaningful and real, people's lives change for the better. And that is why the Core 20 Plus Connector Programme is very close to my heart. Of all the things that we invest in to support the delivery of Core 20 Plus 5, this is of particular importance to me. And I won't use my own words to say why. Andrew and SCW did an excellent job in the interim report where they spoke to you all to find out what are we learning. And I'm going to use your words to reflect back to you why the Core 20 Plus Connectors Programme holds such an important place in my mind. And before I go into that, let me just say that the thinking that went into developing the Core 20 Plus Connector Programme was the COVID-19 pandemic. Every time myself and Minister Nadeem Zahawi, who was the vaccine minister at the time, everywhere we went, the thing that kept coming through was we were making progress in the places where there were trusted voices and faces on the ground. People who could get the message over to the community in a way that those of us who were professionals or politicians couldn't. And so when we developed Core 20 Plus 5, reflecting on that experience, it was clear to me that we must have, as part of our delivery framework, a network of people up and down the country who are those trusted voices and faces. And I want to say a huge thank you to the Health Creation Alliance, to SCW Clinical Support Unit, to the Health Watch, to National Voices for coming together and helping to turn what was a thought into something real. And we're all gathered today because of that. So my thanks to them. What did we learn? Why is the Core 20 Plus Connector Programme so important? Number one, trust. Again, on Sunday night, I was in a meeting with a delegation from the United States, thinking about research. What are we going to do? People are turning away from research, from trials, these life-saving things. And you know what? We all agreed, trust. And that came through in the interim report, that we travel at the speed of trust, that we remember that the messenger is just as important as the message, that we understand there needs to be a parity of esteem of people's voices, that the voices of yourselves as real people in the community must have parity of esteem with the voices of professionals. We learned that we need to share power, that it's no point holding on to power and wondering why nothing changes. We learned that it is important that we work with a system way of thinking, that the answer doesn't sit in NHS England or in any one organization. The answers sit in between all of us. Those were the things that we learned. I know we will have the opportunity to talk more, but I just wanted to use these opening remarks to acknowledge all of that, to call out those things. And I will finish on this thought. I've been thinking a lot about sustainability. How do you sustain progress? And the way to sustain progress is to demonstrate impact. It's really important, especially when we operate in systems where funding and those types of things are made on the basis of ability to demonstrate tangible impact. And as we go forward as connectors, I would like us to consider together how we do that more and more, so that long after we've all gone, because nobody's here forever, that we have built sufficient evidence of the impact of esteeming the voices of people in the community, of supporting them, and that without those connectors, we cannot build trust. And if we don't have trust, quite frankly, we don't have anything. So I look forward to the conversation that we're going to have. Thank you, Sarah.
Thank you so much, Bola. Really appreciate those opening words. And that one about trust really sticks with me. That feels like one of the big things that comes out in so many of the conversations we have around this. I just wanted to update briefly before we go into the panel discussion that I know that some colleagues were having some difficulties in accessing the call, and there was an issue where Zoom wasn't letting us have more than 100 people in. We have the license and everything for it, but we think we've resolved that issue now. So if people had colleagues or friends who they were hoping to join the call who weren't, if you ask them to try to rejoin now, that should be resolved. What is a good event without a little tech issue? So without further ado, then I want to introduce our speakers for the panel who will be joining Bola and I. I'd like to introduce Khadija Amir Sharif, who's the CEO of Shama Women's Centre, who's joining us for this panel. And I know also that we'll be joined by Asma Osman, who's Outreach Manager for Dula Connectors at Approachable Parenting. Asma, if you can just let us know that you're here, that would be brilliant.
I'm here.
Fabulous. Okay. Yep, Asma, we can see you there. So you'll come up on the screen larger in just a moment. But Bola, I just wanted, I know that I've asked each of you to share with everyone a time when you've used community insights to address systemic inequalities in the NHS. And Bola, I wondered if you would go first.
Right. Good afternoon, everybody. I'm CEO of the Shama Women's Centre in Leicester, and we deal with women, particularly from Black, Asian minority ethnic groups. And we actually situate in a very deprived area of Leicester. But one of the things we found is that and to build upon what Bola said, it's about engendering trust in the community to get their buy-in to anything. And the fallout of COVID highlighted the profound effect on Black, Asian, minority ethnic communities in Leicester in terms of mortality rates and take-up of vaccines, etc. So building on that work, we are a delivery partner for the Leicestershire and Rutland ICB. We're one of 3 delivery partners, and for us, I think one of the key challenges has been cancer, the take-up of cancer screening, breast cancer screening, and also cervical cancer screening. So to do that, we needed to recruit connectors that were really the qualities we wanted, with passion, who wanted to make a difference, and we recruited a team of 11 connectors with those with that passion, and one in particular was someone who'd talent. Her name is, you may have heard of her, and she'd come from the Black Afro-Caribbean community, and there's a lot of taboo about going, and nervousness about going for cancer smear tests. So in order to find out why that was, she consulted with community friends and families and community members, and the feedback she was getting, it's all about dignity. Women don't want to take off their underwear when they're going for screening, and something simple as that. And I think also it was a matter of how looking at enablers as an organisation. We wanted to find, and we know what the barriers are. We've heard of them for many, many years. We wanted to do something that enabled a change and enabled that trust and empowered the community to actually take steps. And talent was from that community, and she was able to talk and get feedback, and she actually developed clinical underwear, lingerie, with she tried different things, hooks and tapes and all kinds of things, but in the end they were actually poppers. So basically you put them on before you go for your clinical examination, so you don't have to take off your underwear. A simple solution. But I think that the most important thing is bringing the NHS, the local NHS, into this, buying into this solution. And it's about listening and responding. And I'm really pleased to say they did listen and respond to some extent. Her local GP practice took samples of these popper pants and used them, distributed them to patients, to women who hadn't been for the screening test. In addition to that, the local trust, when they visited our centre, and we showed them an example. I think Bola was at that visit. We were very privileged to have Bola that February last year. They actually took them across to their cancer department, saying, why aren't we using them? The CEO said, we know we should be using them. So and there's plans now to make them disposable as well. But a simple solution like that, and I think for talent, and I have to kind of share this, for her was that her friend had not gone for a smear test because she didn't want to remove her underwear. And because of the popper pants, she actually went and she was diagnosed early on in stages for cancer. So again, that was a simple solution, empowering, but it's NHS working together with the community and going into the community and building that trust and empowering the community with the knowledge. And I think one important thing is that women from those communities are often not connected, want to make a difference, want to learn more about these particular barriers, health inequalities, and how to overcome them. So we produced fact sheets, simple fact sheets that said, what are the signs of cancer, cervical cancer, where to go, where's the nearest place to go, what else can you do, and simple facts that they need to know. And we armed those facts with our connectors as well. We empowered those with their knowledge, so they were confident to go out and talk about them. So it's been a journey, and there's lots more to do. We've got a COPD session next month as well in the local community, because that's a big thing in this time of year. So it's been an amazing journey, but still lots more to do. It's drip feed. We have to continue to deal with it. We've got the trust of the community. We've been around for 38 years, but we need to continue to invest and ensure that this message spreads and continues to sustain itself.
Yes, thank you so much, Khadija. That's a really good example and really interesting to hear. And yeah, just to think of, sometimes we imagine that there's really complex solutions to some of the problems that we're facing, but sometimes it is just as simple as, yeah, some poppers and some underwear. Well, I know I asked you to also prepare a time when you've used community insights to address systemic inequalities, and I'm sure that's most things you do most days in your role, but really great to hear that from you.
Yes.
What a fantastic example, Khadija, and lovely to see you again. And I had the privilege of seeing the wonderful innovation by Talent when I came to your center last year. And you see, that is what I mean about the community. They know the most cost-effective, innovative, and sustainable answers if we let them. And that was just a great example that you've just shared. So for me, I guess there are different layers of influence. So it's great to hear that example that has happened and is happening in Leicester from a national perspective. When we looked at the data and realized that if you're a homeless man, your life expectancy is 46. If you're a homeless woman, your life expectancy is 43. If you have a learning disability and you happen to be Black, your life expectancy is 34. 34. If you're a Black woman, you're 4 times more likely to die in childbirth or the year following delivery. We know that 1 in 8 of the cancers that get diagnosed at a late stage in accident and emergency is happening in the Core 20 plus population group. You look at emergency hospital admissions over winter. 1 in 8 emergency hospital admissions in winter is because of the worsening of COPD, and it's mostly from our Core 20 plus communities. Those are the insights. And what did we then do? For me, one size does not fit all. And when we designed the Core 20 Plus Connectors Programme, it was very much about having representation from the Core 20 Plus communities, because that's what the insight told us. In addition to the Connectors Programme, last year, we invested 3.8 million across 39 of the integrated care systems in collaboration with the Accelerating Access Collaborative. And we launched something called INHIP, which is Innovation for Health Inequalities Programme. And what that was about is to look at some of these data that I've just shared with you and think about what are the innovative ways that we can address these stark inequalities. For example, the Health Innovation Network in Manchester, they're running 3 INHIP projects. One of them is how to reach our Core 20 plus communities with checking their blood pressure, because we know that heart attacks and strokes happen more in these communities, and they're the ones less likely to even know they have a high blood pressure. Again, Health Innovation Network in Manchester, they did a program for the Black and Caribbean communities around inclisiran, which is a medication for bringing down cholesterol. Again, the uptake was relatively lower in the communities that really should be taking it, given that they have the highest strokes and heart attacks. That was another one. There was another really great example in Yorkshire and Humber, where they were looking at admissions for severe asthma in children. And they worked with the communities around inhalers. Do you have the right inhalers? Something as basic, as Khadija was saying, it's not usually expensive things. Are you on the right inhalers to actually reduce this worsening of your asthma that then leads into emergency admissions? That's at a national big level in terms of investment. Another example, prostate cancer. We know that 1 in 8 men will develop prostate cancer over the course of their lives. But when you look at Black men, it's 1 in 4. So they have double the risk. So what did we do? I went to Nottingham along with a wonderful organization that is working there on the ground doing fabulous work, the Domino's Club. And what they do, they know that men from that community, they like to play dominoes. So they bring them together once a month and bring the cancer nurse. They have their local food. They connect over food and they connect over their dominoes game and talk about prostate cancer. Go and have your PSA checked with your GP. And the difference it's making, it's removing the taboo. They're getting men who have had prostate cancer and have come through it, to talk to their peers so that it's not Bola who is saying it or the cancer nurse who is saying it. I'm just giving you these examples to say
Thank you,
the
Maria.
insight can help us at big national level. It also is powerful at individual community level as well.
Thank you so much for sharing that, Bola, and just so many interesting examples there. And when you talk about like the stark inequalities and the statistics around people's life expectancy and at the scale of action needed, I think that really sets the tone for this conversation. So thank you. And Asma, last but not least, I want to introduce Asma Osman, so Outreach Manager for Doula Connectors at Approachable Parenting. I think you've got an example from your work as well.
Yeah, good afternoon. Yeah, obviously through the Doula Connectors and through this project, we are mostly very, very close connected to the women in the community. And there are many examples, but one very recent case, like I can say, just 3 weeks back, we had a referral for a lady who wanted a doula, and she needed an antenatal doula, and she was very early in her pregnancy, but due to isolation, she was really isolated, and she just wanted someone to talk to her in her community language. And the referral sent came from the hospital. It was clearly said on there she needs a doula with the community language, and we did arrange that. Now, just yesterday, my doula met me and she said to me that she's been to an appointment to the hospital, and she came back and she told the doula that I didn't understand anything because there was no translator over there. And this mom, she's had a stillbirth, a full-term stillbirth in October last year. She's had a miscarriage, and I think she doesn't even know what's the reason behind all that because she can't understand. We were really shocked because we thought the hospital has mentioned it clearly on the notes that she needs a translator. So, we wasted time for the trip to the hospital, wasted resources for NHS, and it's the whole appointment has gone to a waste. She has understood nothing. And obviously, we've written back to them now and we're going to follow it up. And the doulas we have are all volunteers. So they can go with her to the hospital, but not maybe every time. And she has no one over here, no family. Husband speaks limited English. So this can be a cause for lots of things. Another example is notes. Many people come back to us saying that our notes were not read or they were just dismissed. They didn't give any importance what we want, what our birthing plan says. For example, if they don't want the blood vaccinations after birth, it's written in the birth plan, but still they are offered to them. And they have, obviously, that's what one of the moms was saying. She said, they know I was so exhausted after the baby and everything, but it was for the doula who had to stand up and advocate and say, no, she doesn't want these vaccinations. So there are lots of things like these which happen, and our moms don't feel confident. So language barrier, obviously, it's a very, very big one. And the other one, on the weekend, someone contacted me, and I'm from Birmingham, and she said she got my number from someone and she wanted breastfeeding support. When I went to her house for breastfeeding support, she didn't have that support from the hospital at all. First baby, and they just tried once in the day, and then they just said that it's okay, just give the baby the bottle. And England is as such so low in breastfeeding. So if that support is not there, people are not going to take up breastfeeding at all. And she contacted me because she wanted the child to latch on, 2 weeks old child. and she just found my number and she contacted me. So we did quickly go and do the home visit. But obviously, it's going to take time before that child is latched on because it's so used to having the bottle.
No, thank you so much for sharing that. And yeah, that's a really shocking example that you describe about, yeah, the person you were speaking to who didn't have a translator in the hospital. And I think what some of the things that strike me there particularly is, I mean, we know that the accessible information standard it should be in place across England, and that there's a certain level expected of health and care organisations. But I would be lying if I said to you that that this was the first time I've heard of an example like this. I've heard of quite a few. And when you think about the mental health impacts of not being able to understand exactly what's happened during a moment like yeah, a miscarriage or a stillborn or anything like that at all, I know it's really significant. And yeah, I think as well, I look at the ambitions for NHS and for healthcare, and I know that it's, you know, one of the things that people talk about all the time is person-centered care and personalised care, and that's what people strive to achieve. But each of you have given lots of occasions where that has fallen short, and that you've been doing the advocacy within health and care organisations to try to shift the dial within that. And so I guess recognising each of your roles as kind of advocates within the system, trying to argue for more equitable health and care, I'm really keen to understand, it's clear each of you have experience like barriers and challenges in making that shift across to a more inclusive approach. What would be your advice for others who face those? What would be the ways that you've overcome those particular challenges? Khadija, maybe I could come to you first, just to share any advice you have from others, or for others rather.
I apologise. I think for mothers, we deal with a lot of mothers. Language is a big barrier, and knowing where to go. It's across the board, not just mothers. Most patients who can't speak the languages, it's a major barrier. So we've developed a solution, and I think I mentioned this to Beau last time I saw it. It's an ESOL program to help you in your stay in hospital, and it's a starting point. I'm really proud of it. We're going to launch it in March, and that is looking at simple things that a patient would want to communicate to a clinician, like I'm in pain. So it's about empowering communities as well, giving them the tools and the confidence to be able to communicate that, because you can't get translators, interpreters all the time. We know it's not happening on the ground. So it's empowering individuals and communities to be able to speak for themselves. I think that's going to be very, very important in terms of addressing some of these barriers, and that's the approach we're taking.
Thank you. That's really interesting to hear. Yeah, I think that empowerment, which is really important, and especially when you're talking about some things that are also very basic rights. Bola, what advice would you have for others? Yeah.
To be honest, I'm not sure that I should sit here and be offering advice. I come with a sense of responsibility, in terms of what are we going to do? Because Khadija and Asma and others are telling us what is happening on the ground. I just wanted to mention that we are currently working on a community languages and interpretation program of work, precisely because we hear this feedback over and over again. Many of you may have seen the Health Safety Investigation Branch report last year into the death of the 5-year-old Romanian child whose appointment were being sent in English. And so just to reinforce that when we talk about language barriers, we're not just talking about Black and minority ethnic populations. This child is of European ancestry. And I think it's really important to understand that community languages and interpretation, and the need for us to have a very clear framework for action, is not a race conversation. It's an issue that affects different communities. That's just the point that I just wanted to make. So there is that. The second point that I want to make is, how do we build self-advocacy? And what I mean by that is, when things go wrong, Oftentimes people will tell their family, they'll tell their friends. Very rarely do we see people putting things in formally. The problem with that is it's then missing from the data. And if it's not in the data, it's very hard to drive improvement. So I wanted to start by, first of all, owning responsibility. And I then want to say, what can we do as community leaders? I think we should all consider from this gathering today, taking an action on improving our community's understanding of the mechanisms and processes for reporting when things go wrong, so that it's being counted in the data. And when it starts to show up in the data, it begins to drive improvement. And I'll give an example. Yesterday, I was chairing a National Health Inequalities Improvement Forum, and we had an excellent story from Mid and South Essex NHS Foundation Trust, who won the HSJ Health Inequalities Award last year. And they won that award because their patient experience data over a number of years showed them that people with sickle cell were reporting that traveling all the way to Royal Free for their care was not ideal. And the wonderful thing is what that hospital did. They responded, they invested in specialist sickle cell nurses, in recruiting consultants, and putting in a service in Basildon and Torrock, which is one of their local trusts. And you should see the difference in the patient experience data. So I just want to leave it with us as leaders on this call to please work on that with our communities. It does work. Thank you,
Thank
Sarah.
you. Thank you very much. And Bola, it's like you read my mind, because in the next session, we'll have a presenter from Mid and South Essex talking about meaningful partnerships between people, communities and the NHS. So I just would like to thank you, Bola, Khadija, Asma. Thank you so much for sharing your thoughts with us today. I learned a lot and so really appreciate that. And before we wrap up this session, I'd just like to ask everyone on the call, I'm conscious that all of us in different ways are involved in advocating for more inclusive health and care. And often there's more support that we can need. And sometimes it's good to know what type of support other people are aware of and also what they want. And so I'm asking Pavi just to share the final Mentimeter for the session. And that's around what practical support would make it easier for you to use community insights to address systemic inequalities in the NHS. So you can do that using the link in the chat, the QR code, or else by going to menti.com and putting in the code 26189621. So yes, that question really is, what practical support would make it easier for you to use community insights to address systemic inequalities in the NHS? I can see people are ready, popping through answers. And I'm just looking through the chat here, and I can just see that lots of the messages from the main panel really has been resonated within the chat. Some of those common issues beyond community languages, but also looking at BSL. We really hear this across all the types of communication needs that often aren't met within health and care services. Okay, so people have said access to council meetings on health, knowing who the councillors are that make policies, time, promotion. People of Afro-Caribbean heritage or background to know they have health respect, trust and health equality. Don't assume we have stronger pain thresholds. That's a really powerful one there. Thank you so much for sharing that. Council meetings, having support from the councillors and director to implement what is really important to the community. Capability and capacity to use qualitative analysis of our community insights to get to the heart of what our community experiences, views and opinions are. Fab, I can see they're coming in quickly there. There's 28 responses. We'll take those away and we'll have a look at those to see if there's anything more that can be done within that space. But yes, just thank you so much to our speakers for today's first session. We've tried to build in a decent amount of breaks. We know that we're online all afternoon and we don't want people to be sitting down at the screens the whole time. So we'll move to a break now until 3 p.m. The next session of the day will be at 3 o'clock and it will be on developing strong, equal and trusting partnerships between the NHS with people and communities. Now we ask you, please don't log out of this meeting, but stay logged in and just pop your camera off and then pop yourself on mute. And then you'll know that we're starting again because we'll all pop our cameras back on and I'll be speaking away. But it's just easier rather than everyone moving to the waiting room and then having to be readmitted again. So yeah, just please pop your camera off and pop yourself on mute for now. And just thank you so much to the speakers for our first session.